News with Craig McMurran.
The COVID booster programme is to be expanded and speeded up, but there are questions about how Scotland's NHS will be able to roll that out. Calls have been made for mass vaccination centres to be brought back.
Now, more people are eligible to get their second coronavirus jabs and their boosters. Speaking on Good Morning Scotland, the Health Secretary Hamza Youssef admitted it's difficult for the NHS to keep up with demand.
You can open up vaccination centres, but you have to have the staff to be able to staff them. Now, the difference with the first time round is that we hadn't fully remobilised the NHS. Now, the NHS is under significant pressure. What we don't want to do is take people away from really core, important, significant duties in the NHS that is already under significant pressure and get them doing vaccinations. Now, we will certainly do what we can, but we have to, before JCVI advice came out yesterday, we'd need an additional 440 whole-time equivalents to help us with that vaccination programme. With JCVI advice yesterday, that will significantly increase.
Well, I'm joined now by the Shadow Cabinet Secretary for Health and Social Care, Dr Sandesh Gulhani. Thank you very much for joining us this lunchtime.
Hello, thank you.
Now, what difficulties are you hearing in terms of people getting their appointments for their second jabs or indeed their boosters?
So the difficulties we're seeing is people waiting a very long time, often in the cold and rain. They're having to travel an awfully long way, and there's just no appointments available. Now, we know, behavioural experts have told us that convenience is one of the main factors to get people to take their vaccines, especially in the younger age groups. I am concerned about the Omicron variant. And we know that vaccines are our best defence. They are vital. They're the way that we're going to be getting through things. So I need everyone to go out there and get their vaccine. And we need to make it as easy as possible to do that. And the way we can do that is to reopen these vaccination centres to get people in and get it done as quickly as possible to protect as many people as possible, as quickly as possible.
Yeah, we are being told by the Scottish Government that people should come forward and get vaccinated just as soon as they can, that the website is open for booking appointments for most categories. Also, we were told a couple of weeks ago that 16 and 17-year-olds should be able to get their second doses. We're now being told 12 to 15 should be as well. But we've actually had a few people try to access the appointment booking site today, and nobody has been able to get through to even the booking the appointment status. You need to have some kind of special status.
I'm so happy that you've said that, because that's exactly the case. It's so difficult for people to book. We are putting barriers up in front of people to get their boosters, to get their vaccinations, and yet we're trying to encourage them to go. Again, I want to stress, I want everyone to get vaccinated, and the way to do that is to make it easy, make it convenient, make people think, oh, that was straightforward. I've gone and got my booster. Wonderful. If that needs to happen again, I can do that. And if we allow people to have it easy, we allow people to get their boosters, then people will do it, and that's what we need because of the variant that's coming. That's why we've seen this advice. This is why we've seen this massive boost in what we need. So please, everyone, go and get your boosters.
It is easy, obviously, to say that when you're not having to organise it. And we heard there Hamza Youssef saying it is difficult for the NHS to keep up. You know, how would you manage to reopen the mass vaccination centres without taking away from the likes of cancer treatment?
We need to be absolutely clear that vaccination needs to be our top priority. Why? It needs to be our top priority because actually if we get a huge number of people who contract the new variant and end up in hospital because of it, because they've not been vaccinated, that will overwhelm our health service, putting our health service at risk. And it's that we need to avoid. And that's something the government has said all the way through, and it's something I agree with. We cannot have the health service overwhelmed. So frankly, I've got no idea why this is not being given top priority. The UK Armed Forces are doing amazing work here to help with the vaccine rollout in some areas, and we need to make this the top priority.
Would you, though, be prepared to take away from other NHS services to staff up the vaccination?
We need to. We're all aware that there is a finite resource in the NHS. We are aware of that, and the staff is the finite resource. It's about prioritisation. It's about forward planning. It's about ensuring that we make the right decisions at the right time. Stopping the NHS getting overwhelmed by people contracting COVID, especially the new variant, which I'm concerned about, I know we're all concerned about, To stop that from happening is the best way to protect the NHS, not just now in the short term, but in the medium and the long term. And this is one of the big problems we're seeing with Humza Yousaf. He doesn't forward plan. He does knee-jerk reactions. I'm suggesting we forward plan and we protect the people of this country and we ensure we get the jags into their arms, and we need to do that as quickly as possible.
Just in 10 seconds, even if that means drawing from other parts of the NHS.
It's a finite resource. We need to make sure that the people of this country are protected and our NHS is protected. And the only way we can protect the NHS being overwhelmed is getting these jags into people's arms.
Dr. Sandesh Kulhani, thank you very much indeed from the Scottish Conservatives. We did put in a bid to speak to somebody from the Scottish Government on the vaccination rollout, but nobody was available.